Dear family, do you wobble when putting on socks with one foot each day? Don't underestimate this simple action. It serves as a veritable barometer for gauging your body's rate of aging. Data reveals that only 14% of individuals over 40 can perform it steadily. Worried about aging too quickly or losing your footing? Today we're sharing a scientifically proven anti-aging routine that requires no equipment and can be practiced at home, effortlessly slowing down the aging process. The scientific validity of the single-leg sock putting test has been corroborated by numerous global clinical studies. Maintaining human balance relies on the coordinated operation of the vestibular system, proprioceptive system, and visual system. The act of putting on a sock while standing on one leg demands these three systems to rapidly integrate information efficiently, while simultaneously engaging key muscle groups, the quadriceps and hamstrings in the legs, alongside the core muscles like the transverse abdominis and erector spinae. For individuals aged 40 and above, muscle mass naturally diminishes by 1 to 2% annually with advancing years. Declining neural cell activity slows signal transmission, progressively reducing muscle-brain coordination. These physiological changes directly contribute to instability during single-leg standing, potentially rendering sock putting impossible. A 2025 study by Harbin Medical University, involving 2,610 individuals aged 60 and above, further confirmed that those unable to perform this exercise had a 2.3 to 3.1 times higher probability of falling in daily life compared to those who could. Falls are the primary cause of fractures, bedridden states, and loss of independent living ability among middle-aged and elderly individuals. Updated 2025 data from the World Health Organization indicates that over 680,000 people globally die annually from fall-related injuries. Among survivors, approximately 20% suffer long-term disability due to fractures or spinal injuries, imposing significant financial and emotional burdens on families. Notably, the one-legged sock putting test also accurately reflects discrepancies between one's biological age and chronological age. In clinical practice, some individuals in their 50s who maintain regular exercise routines exhibit robust muscle strength and balance, effortlessly performing this test with a biological age as low as approximately 40. Conversely, some individuals in their 30s, due to prolonged sedentary lifestyles and lack of physical activity, demonstrate weak muscle strength and poor balance, failing the test with a biological age significantly exceeding their chronological age. Currently, this test is widely employed in clinical settings such as post-stroke rehabilitation and functional assessment for arthritis patients, serving as a crucial indicator for evaluating physical recovery. For the general public, the test requires no specialized equipment, only a flat surface. Successfully completing it indicates good balance and muscle strength. Difficulty suggests the need for targeted training to delay physical decline. Indeed, the scientific intervention of physical training to counteract the aging process has long been a consensus within the global field of sports medicine. 5 often overlooked movements: single leg Romanian deadlift, squat reach, wide stance, Superman exercise, and piriformis stretch appear deceptively simple yet represent core functional training validated by extensive research. Their advantage lies in mirroring everyday movement patterns, specifically enhancing strength, balance, flexibility, and joint mobility to fundamentally improve physical function. A 2025 review study by Takuji Kawamura's team at Tohoku University, published in the journal Aging, confirmed that such structured functional movements can influence epigenetic markers at the molecular level, leading to a substantial reduction in biological age and even achieving an age reversal effect. As a core exercise for posterior chin training, the single-leg RDL specifically targets the gluteal muscles, hamstrings, and core stabilizers. From an anatomical perspective, the hip hinge activation pattern of this movement precisely engages the gluteus maximus, the largest muscle group in the human body. Insufficient gluteal strength is a primary cause of lower back pain for many individuals, as the lumbar spine compensates passively to compensate for deficient gluteal function. For middle-aged and elderly individuals, the single-leg ADL significantly enhances balance and neuromuscular control during single-leg support, reducing fall risk while slowing leg muscle loss. Research indicates that 8 weeks of consistent single-leg RDL training increases single-leg balance duration by over 40% and enhances hamstring strength by 35% in this demographic. These improvements directly translate to greater stability during daily walking and stair navigation. The squat stretch, combining a squat with thoracic spine rotation, is an effective dynamic stretch for improving posture in sedentary individuals. Prolonged sitting in modern lifestyles often leads to thoracic kyphosis, shoulder joint stiffness, and restricted hip mobility, subsequently causing rounded shoulders, hunched posture, and chronic pain in the shoulders, neck, and lumbar spine. A 2025 study in the Journal of Sports Medicine confirmed that dynamic stretches like the squat stretch significantly outperform static stretches in improving posture among sedentary individuals. This exercise opens the hips through squatting, stretches the back and shoulder muscles via thoracic rotation, and simultaneously activates core muscles for stability, achieving dual improvements in flexibility and core strength. During proper execution, practitioners distinctly perceive a stretch along the lateral back and shoulders, a crucial indicator for relieving muscle tension and enhancing thoracic mobility. The wide stance position specifically targets enhancing flexibility in the inner thigh muscles and hip joints. Many individuals, due to insufficient hip abduction capacity and weak inner thigh muscles, tend to adopt incorrect knee-in posture during lower body training. This not only diminishes training effectiveness but also substantially increases the risk of knee injury. The wide stance position, achieved by placing feet wider than shoulder width apart with toes slightly turned outwards, bending the knees, and pushing the hips back to lower the center of gravity, effectively stretches and strengthens the adductor muscles of the inner thighs. This enhances hip abduction and external rotation capabilities. Research from Harbin Medical University in 2025 confirmed that lower body strength and hip flexibility training can reduce fall risks in middle-aged and elderly individuals. The wide stance squat serves as a foundational exercise for such training, effectively improving gait stability and reducing knee strain during stair navigation. The Superman exercise, another crucial posterior chin movement, primarily targets the erector spinae, gluteus maximus, and core muscles. The erector spinae muscles are pivotal for spinal stability. Their weakness may lead to stooped posture and increased risk of lumbar disc herniation. The Superman exercise performed prone with arms extended forward and legs straightened before simultaneous lifting effectively strengthens these muscles while activating the gluteus maximus and hamstrings, thereby improving anterior-posterior muscle balance. For knee and lower back pain stemming from tight quadriceps and weak posterior muscles due to prolonged sitting, the Superman exercise offers significant relief. Beginners may start by lifting arms or legs separately to gradually activate back muscles, avoiding compensatory effort. Progress to the full movement once strength improves. The piriformis stretch specifically targets the deep piriformis muscle within the buttocks. The sciatic nerve passes directly beneath this muscle. Prolonged sitting or improper exercise can cause the piriformis to become tight and rigid, potentially compressing the sciatic nerve and triggering radiating pain in the buttocks and legs, known as sciatica, which severely impacts daily activities. Multiple sports medicine studies in 2025 confirmed that regular piriformis stretches can increase hip mobility by over 30%, significantly reducing sciatica incidence. This exercise relaxes tense muscles through specific postures, alleviating nerve compression while improving hip flexibility and enhancing lower body range of motion. It is particularly suitable for office workers and middle-aged, elderly individuals with prolonged sitting habits. The commonality among these 5 exercises lies in their alignment with everyday movement patterns, translating training benefits directly into daily functional capacity. Requiring no expensive equipment, they utilize body weight alone. A 2025 study from Tohoku University in Japan revealed that individuals over 40 who consistently performed these 5 functional training categories weekly could reduce their apparent genetic age by approximately 2 years, with muscle loss occurring 30% slower than in non-exercising peers. This low-cost, high-return training profile makes it an ideal anti-aging solution for the general public. Whether at home, in the office, or outdoors, all that's required is a small, flat space. How can one accurately gauge training effectiveness? A scientific self-assessment system is essential. The 90-day self-test challenge is a performance verification tool designed based on exercise physiology principles. Its core logic lies in quantifying improvements in physical function by tracking changes in bodily metrics before and after training. Research published by ASMA in 2025 confirms that 90 days of structured resistance training effectively reverses muscle disuse, atrophy, and restores neuromuscular control. This 90-day period coincides precisely with the critical cycle for muscle fiber hypertrophy, neural adaptation, and habit formation, allowing training effects to manifest fully. The 3 core initial assessment components: the single-leg sock putting test, bodyweight single-leg RDL stability test, and piriformis stretch tolerance test correspond respectively to balance, strength, stability, and flexibility, providing a comprehensive reflection of core functional status. To ensure accurate results, thorough preparation is essential. Select a flat, dry, obstacle-free surface, avoiding slippery tiles or soft carpets that compromise balance. Wear standard cotton socks without slip-resistant footwear to accurately gauge balance. Conduct tests approximately 1 hour after waking, as fasting yields more objective results. The single-leg sock putting test procedure is as follows. Remove footwear and stand naturally. Lift either foot approximately 10 centimeters off the ground and attempt to place a sock on the raised foot without using any support. Timing commences from foot liftoff until the sock is fully fitted and the individual stands steady. Record both completion time and sway count, where sway is defined as a center of gravity shift exceeding 5 centimeters or adjustment of the supporting foot. The benchmark for healthy adults is completion within 20 seconds with no more than 1 sway. Beginners often struggle to meet this due to insufficient balance. Bodyweight single-leg RDL stability test: stand with feet shoulder width apart. Shift weight onto one leg while extending the other leg straight behind. Slowly lean forward, allowing arms to hang naturally toward the floor. Then return to the starting position. Repeat 10 times. Assess form quality, noting whether the back remains straight, whether the supporting knee caves inward, whether the torso tilts sideways. Healthy adults should complete 10 standard repetitions with sustained body stability. The piriformis stretch tolerance test requires lying supine on a yoga mat with knees bent. Cross one ankle over the opposite knee to form a 4 shape. Then grasp the corresponding thigh with both hands. Gently draw the leg towards the chest until a distinct gluteal stretch is felt, holding the position. Record the duration of comfortable maintenance and discomfort level. A healthy adult should maintain this for over 30 seconds with discomfort not exceeding level 3. Initial test data must be meticulously recorded, either via mobile memo or notebook, accompanied by textual descriptions for future comparison. The 90-day training cycle comprises 3 phases. Phase 1 is the adaptation period, with the core objective being familiarization with standard movement patterns and establishing correct force generation habits. Training intensity should not be excessive, for example, 5 repetitions per leg for single-leg RDLs. Phase 2 is the progression phase, focusing on increasing training intensity to enhance muscular strength and flexibility, for example, performing 8 repetitions per leg for single-leg RDLs. Phase 3 is the consolidation phase, aimed at stabilizing training outcomes and improving physical adaptability. For example, performing 10 repetitions per leg for single-leg RDLs. Midterm assessments should be conducted on days 30 and 60 to record metric changes and adjust the training program. If the one-legged sock test duration improves by 5 seconds on day 30 compared to baseline, this indicates effective training. Minimal improvement may suggest insufficient intensity or poor form, necessitating targeted adjustments. The final reassessment after 90 days must strictly adhere to the initial testing protocol, ensuring consistency in environment, timing, and methodology to guarantee scientific comparability. Research from Harbin Medical University in 2025 demonstrated that elderly participants undergoing 90 days of similar training saw their balance test pass rate rise from 47.4% to 72.1%, with a significant reduction in fall risk. This quantifiable validation transforms training outcomes from vague feelings into tangible improvements, greatly enhancing motivation to persist. It is crucial to note that incorrect training methods not only fail to achieve anti-aging benefits but may also lead to injury. 3 prevalent misconceptions in anti-aging training are: substituting single-leg RDL bends for hip hinges, performing arm-only extensions during squats without thoracic rotation, and engaging the neck during Superman exercises. These errors fundamentally involve incorrect force generation patterns, resulting in inadequate activation of target muscle groups and excessive involvement of compensatory muscles. A 2025 study in the Journal of Sports Medicine revealed that suboptimal movement execution reduces training efficacy by 60% and triples injury risk. Thus, avoiding these pitfalls is crucial for ensuring both training effectiveness and safety. The misconception of substituting single-leg RDLs for hip hinges stems primarily from insufficient core strength and unclear understanding of the hip hinge activation pattern. From a biomechanical perspective, whereas bending over involves folding around the lumbar spine, resulting in a rounded back, this distinction directly alters the distribution of force. Hip hinging concentrates power in the glutes and hamstrings, while bending over shifts all load onto the lumbar spine. Prolonged misuse may lead to lumbar disc herniation, lumbar muscle strain, and other injuries. Correcting this error can be aided by using a mirror to monitor spinal alignment throughout the movement. Employ the imagination method. Picture a chair behind your hips, then sit back into it rather than bending to touch the ground. Alternatively, use a resistance band held by an assistant, who gently pulls from behind, guiding your hips rearward to rapidly establish correct form. Success is confirmed by post-exercise soreness in the glutes and hamstrings, not the lower back. The misconception of performing squat stretches by rotating only the arms without moving the thoracic spine stems from poor thoracic flexibility and chronic tension in the shoulder and back muscles. This prevents full thoracic rotation, leading individuals to fake the movement by rotating their arms instead. A classic example of ineffective stretching. Anatomically, the target muscle groups for the squat stretch are the erector spinae around the thoracic spine, trapezius, deltoids at the shoulder joint, and pectoralis major. If only the arms rotate without thoracic spine rotation, the stretch is confined to the arm muscles, failing to engage the core tension areas in the back and shoulders. This also increases the load on the shoulder joint. The key correction lies in first activating thoracic rotation capacity. Prior to training, perform a 5-minute thoracic rotation warm-up, such as sitting with legs together and slowly rotating the torso left and right. During the formal exercise, ensure proper squat depth and maintain straight arms. Allow the upward-reaching hand to initiate thoracic rotation, tracking the hand's direction with your gaze while sensing the stretch in the back muscles. When a distinct stretch is felt in the back and shoulders, accompanied by a post-exercise sense of lightness and temporary improvement in rounded shoulders or stooped posture, this indicates the movement has been correctly executed. The common misconception of using neck strength during the Superman exercise stems fundamentally from insufficient back muscle strength, forcing the neck muscles to compensate. The primary function of neck muscles is to support the head's weight. When underdeveloped, prolonged compensation can lead to loss of cervical spine curvature, neck and shoulder strain, and other injuries. Correction methods include maintaining a neutral neck position aligned with the spine, gaze directed towards the floor, placing a thin pillow beneath the forehead to limit neck elevation, And progressive training, first lifting arms alone, then legs alone. Finally, arms and legs together to gradually activate the back muscles. Successful correction is indicated by post-exercise soreness in the back and glutes, not the neck. The root of all training pitfalls lies in prioritizing form over function, focusing on appearance while neglecting proper biomechanics. Therefore, master standard movement patterns before increasing repetitions or intensity, particularly for middle-aged and elderly individuals. Technique always trumps volume. Only by establishing correct movement habits can training efficacy be ensured and injury prevented. A low-barrier, high-compliance training program is essential for sustained anti-aging practice. This anti-aging program requires neither extensive time spent in the gym nor expensive equipment. A yoga mat suffices, though even without one, exercises can be performed in living room or bedroom spaces. Training 3 times weekly for 20 minutes per session effectively enhances muscle strength, balance, and flexibility, fully aligning with the latest 2025 research in exercise physiology and behavioral science. The program's design is grounded in robust scientific rationale. From an exercise physiology perspective, muscle repair and growth require 48 hours. Training 3 times weekly with 1 to 2 days rest allows sufficient recovery time, preventing fatigue and injury from overtraining. The 20-minute duration aligns with the physical capabilities of older adults and working professionals. Longer sessions increase physical strain and reduce adherence, whereas 20 minutes enables focused execution of core movements to achieve training outcomes. From behavioral science, low-barrier programs significantly boost adherence. A 2025 Journal of Sports Medicine controlled trial demonstrated that a hybrid model of twice-weekly home workouts plus twice-weekly brisk outdoor walks achieved a 58% higher retention rate than traditional gym memberships, with 0 injuries. The core reason was that low activation friction made consistency far easier to achieve. Monday and Thursday are designated as strength and balance days, featuring single-leg RDLs and Superman exercises. Single-leg RDL, 8 reps per leg times 3 sets with 30-second rest intervals. This parameter aligns with muscular endurance training requirements. Brief rest allows muscles to train under mild fatigue, enhancing endurance and neuromuscular control. Maintain a straight back and slightly bent knees, focusing on engaging the glutes and hamstrings. Superman exercise, 12 reps times 3 sets. Hold each lift for 3 seconds before lowering. This isometric contraction enhances core stability. Maintain a neutral neck position and engage the back muscles throughout. Tuesday and Friday constitute flexibility and stretching days, featuring squat stretches plus wide stance stretches. Squat stretches, 30 seconds per side times 3 sets. Static stretches exceeding 20 seconds thoroughly engage thoracic, spine, and shoulder joint muscles. Maintain full squat depth whilst performing, focusing on thoracic rotation. Wide stance stretch, 40 seconds times 3 sets. This duration effectively stretches the inner thigh adductors and hip muscles. Keep knees aligned with toes to prevent inward rotation, chest lifted, and core engaged. Wednesday and Saturday are designated daily consolidation days, featuring piriformis stretches plus fragmented balance training. Piriformis stretch, 60 seconds per side times 2 sets. This duration thoroughly relaxes the deep piriformis muscle in the buttocks, alleviating tension from prolonged sitting. Maintain even breathing throughout, avoiding breath holding. The fragmented balance training forms the program's core innovation. Drawing upon the Chinese Center for Disease Control and Prevention's 2025 research on fragmented exercise, it utilizes brief intervals such as brushing teeth, waiting for lifts, or watching television adverts for single-leg standing exercises. Each leg is held for 1 minute, seamlessly integrating training into daily routines without requiring additional time, while continuously enhancing balance. Research indicates that the health benefits of such fragmented exercise can accumulate. When the total duration is met, it yields results comparable to continuous exercise. Sunday is designated as a complete rest day, where thorough physical and mental relaxation is paramount. Muscle growth and repair occur during rest periods. Adequate recuperation prevents fatigue and psychological resistance caused by overtraining, allowing the body to approach the following week's training in optimal condition. Rest days permit enjoying meals and spending time with family without psychological burden. Key considerations for the program include performing a 5-minute dynamic warm-up before training, such as high knees, trunk rotations, and ankle circles, to elevate body temperature, activate muscles and joints, and prevent injury. 3 to 5 minutes of static stretching post-workout to alleviate muscle tension and promote recovery. Maintaining flexibility in training, reduce repetitions and duration when fatigued or experiencing discomfort, without forcing through. Dietary adjustments. Moderately increase protein intake from eggs, milk, lean meats, etc., to provide building blocks for muscle repair and growth, enhancing training outcomes. The core purpose of anti-aging training has never been to cultivate exaggerated muscle definition, but rather to help individuals maintain bodily control, enhance quality of life, delay functional decline, and preserve the capacity for independent living at every age, enabling one to savor life's pleasures. This represents a long-term health investment whose value far surpasses short-term muscle gains or weight loss. Regular, structured exercise can even reverse epigenetic age at the molecular level, achieving genuine age reversal. The essence of aging lies in bodily functional decline, primarily manifested through 3 aspects: muscle mass loss, diminished balance, and reduced flexibility. Regarding muscle mass, human muscular strength declines by 1% to 2% annually from age 30 onwards. After 40, muscle mass decreases by 8% every decade, accelerating to 15% per decade after 70. After age 50, leg muscle mass diminishes by 1% to 2% annually, with muscle strength declining by 1.5% to 5% per year. These muscle loss, termed sarcopenia, not only reduces strength, making daily tasks like bending to tie shoelaces difficult, but also lowers basal metabolic rate, increases obesity risk, and weakens skeletal protective barriers. Epidemiological studies on sarcopenia in the Chinese population indicate a prevalence rate of 8.9% to 38.8% among community-dwelling older adults, rising to as high as 67.1% in those aged 80 and above. Prevalence is higher in men than women and increases significantly with age. Anti-aging training effectively delays muscle loss and may even increase muscle mass. Research from Tohoku University in Japan indicates that sedentary middle-aged women who underwent 8 weeks of aerobic and strength training experienced a reduction of 2 years in their epigenetic age. Middle-aged and elderly individuals who consistently performed functional training 3 times weekly exhibited a 30% slower rate of muscle loss compared to non-exercisers. Regarding balance capability, diminished equilibrium is the primary cause of falls among middle-aged and elderly individuals, with falls being the leading factor in disability and mortality within this demographic. World Health Organization data indicates that over 680,000 people globally die annually from fall-related injuries, with approximately 20% of survivors suffering long-term disability due to hip fractures, spinal injuries, and similar complications. Anti-aging exercises such as single-leg Romanian deadlifts and fragmented balance training significantly enhance equilibrium and neuromuscular control, promoting steadier daily movement and averting the catastrophic consequences of falls. Regarding flexibility, diminished suppleness is a primary cause of joint pain and restricted mobility. With advancing age, muscles and ligaments progressively stiffen, reducing joint range of motion and leading to difficulties such as bending over or raising the arms, severely impacting quality of life. Anti-aging exercises such as deep squat stretches, wide stance standing, and piriformis stretches effectively improve muscle and ligament flexibility, increase joint range of motion, and alleviate joint pain. Research indicates that middle-aged and elderly individuals who consistently engage in flexibility training experience a 40% reduction in joint pain incidence, alongside a significant decrease in the risk of sports injuries such as muscle strains and joint sprains. Beyond physical benefits, anti-aging training yields substantial mental health advantages. Exercise stimulates the brain's release of dopamine and endorphins, so-called feel-good hormones, effectively alleviating negative emotions like anxiety and depression while boosting self-confidence and overall well-being. A 2023 study published in the journal Aging Cell demonstrated that 30 sedentary middle-aged individuals who undertook 23-minute training sessions per week experienced a 34% reduction in depression scores after 4 weeks, robustly confirming exercise's positive impact on psychological well-being. Many middle-aged and elderly individuals who maintain consistent training not only enjoy improved physical health but also develop a more positive and optimistic mindset, enabling them to better navigate life's pressures and challenges. Anti-aging training further helps individuals redefine their understanding of aging, not as a passive, irreversible process, but as one that can be delayed through active intervention. The notion that as one ages, physical decline is inevitable represents a negative mindset. Scientific research and clinical practice both demonstrate that with willingness to act, the trajectory of bodily aging can be altered. Simultaneously, anti-aging training embodies a responsibility both to oneself and to one's family. Maintaining physical health allows one to savor life's pleasures while reducing dependence on loved ones. Ultimately, it must be emphasized that the optimal time for anti-aging training is always now. The body's aging process waits for no one. Muscle loss, diminished balance, and reduced flexibility accumulate day by day. Waiting until significant physical issues arise before training often misses the prime window for intervention, greatly diminishing its effectiveness. As the saying goes, the best time to start was yesterday. The second best time is now. Anti-aging training is not a short-term task but a lifelong lifestyle. It requires neither vast amounts of time nor money. Merely carve out a little time each day to perform a few simple exercises consistently, and you'll reap unexpected health rewards. When we can effortlessly bend to tie our shoelaces, ascend and descend stairs with steadiness, accompany family on walks and travels, and manage daily life independently, we come to understand that the significance of anti-aging training extends far beyond mere fitness. It is an investment in life itself, a pursuit of a fulfilling existence.